Good morning, ma'am. Good morning to all. Today's topic is the modes of the disease transmission. What do you mean by the modes of the disease transmission?
Cause.
An infectious agent may be transmitted from its natural reservoir to the susceptible host in a different ways. Okay, we will see one by the direct method or the indirect method. In the direct method, there is a skin-to-skin contact or the direct contact and the droplet spread infection. In the indirect, there is the airborne, vector-borne and the vehicle-borne, as well as the mechanical and the biological. In the direct mode of disease transmission, direct physical contact. In the direct physical contact, by the first the touching, skin-to-skin contact, by the touching and shaking the hand, like in which, for example, can you give anyone? Scabies, skin infection, then leprosy. In that infection caused by the touching. Then kissing in the ringworm infection. Then sexual transmitted diseases by the sexual contact. Then vertical transmission means the disease transmitted from the mother to the child. From the at the antenatal period, intranatal and the postnatal period, like the syphilis, HIV or AIDS, then hepatitis B infection, then syphilis, that from the vertical transmission. Then direct contact with the animals or the soil. In the infected animal, through the infected animal, like the rabies. Rabies from the dog bite, infected dog bite to the healthy person, then rabies will appear. Then snake bite, scorpion bite. And then in the soil, infected soil like leptospirosis, then plague, that is coming the direct contact with the animal of the soil. Then the direct droplet spread infection. It is caused by the coughing and sneezing from the infected person, like the tuberculosis, COVID-19, influenza, then whooping cough, pertussis. In that infection spread from the infected person to the healthy person through the coughing, sneezing. Okay. Then the indirect modes of the disease transmission. In that the fomite transmission. In fomite transmission, there is through the contaminated objects, like pediculosis. In the pediculosis, same comb using, then it will appear. Then conjunctivitis. Then in the foodborne diseases, like through the contaminated foods, in the typhoid, food poisoning, hepatitis A and hepatitis E through the fecal or oral. Okay. Then the vector-borne transmission disease through the infected insect, like malaria, anaphylaxis through the anaphylaxis mosquitoes, malaria. Then Aedes aegypti mosquitoes will give infection to the dengue. Okay. Then the waterborne transmission through the contaminated water, like typhoid, cholera, dysentery. Then airborne transmission. In the droplet infection, there is a transmission through the coughing and sneezing, but the distance is less than the 3 meters. But here, airborne transmission, there is a particles suspended in the air, and that cause the airborne transmission, like Ebola, COVID-19 sometimes, then swine flu, then measles, then the prevent. How it will prevent? Using the PPE, personal protective equipments, like wearing the mask, gloves, face mask, then apron, then
Hand hygiene, environmental hygiene,
then contaminate food hygiene,
hygiene,
yes.
cleanliness,
Physical distance,
safe.
Okay. Then what is the mode of the disease transmission?
Airborne,
Vector-borne, droplet infection,
Droplet.
direct and indirect.
Okay. Most animal by transmission, which?
Leptospirosis, rabies.
Okay. Thank you.